Hello, guys. This is Dr. Louis once again for another new video for you guys. But tonight, I'm gonna be talking about the subcutaneous injection site and how to administer and order if they give you a subcutaneous injection, or they may give you, for example, airplane or any medication subcutaneously, mostly in the abdomen. You may find this question. Now, before I continue with this video, I'm asking every single one of you guys, go to my YouTube channel, Nclex review, and subscribe. Like I said, from the previous video, I asked every single one of you guys, nursing student, I need more subscribers, guys. I need more subscribers so I can continue to do the job. Now, the question may be, select other apply. What are the following site or location you should administer a subcutaneous injection? Now, I'm gonna be talking tonight, but guys, I'm asking you, if you want a full review, Dr. Louis is gonna teach you exactly how to pass your Nclex exam. Like I always say, I know the secret of Nclex. As a doctor, and of course, a licensed nurse, I can teach you that with the tactic I have, with the strategy I have, you can pass Nclex. I have two students who pass Nclex this week. We are on 11, 18, 20, 21. Two female students pass Nclex just like that. Now, if you go to my Facebook page, you would see the name of the student. You can Google it. You can double check that. Who passed Nclex this week. Now, I have on my Facebook page, Louis Nclex review. You will see that. Now, if you want to pass your Nclex, you speak English, you speak French, you speak or any language that you speak, call Dr. Louis for your full review. Don't let anybody out there fool you. Don't let anybody they're gonna give you a lot of content, a lot of papers, and then got with no explanation. This is not Dr. Louis. If you come to me, I'm gonna explain you. I'm gonna take the time to teach you the secret of Nclex, guys. And the number to call Dr. Louis is 561-319-4660. Now, I have a lot of students that speak Creole, they speak English. I do have different groups. I have an English group, I have Creole group. Now, guys, I am the number one instructor for your Nclex review. No doubt, no comparison. Now, tonight, I'm gonna teach you, as a Nclex tip questions, how to administer a subcutaneous injection. In order, I show you the picture at the beginning, the location. Now, let's do the first question. What are the following location? What are the site, the most common site you should administer a subcutaneous injection? Let's go. The very first location is always abdomen. You always select abdomen. Listen, help me and talk to me. The abdomen. Now, the question is, it's not a question you administer in the abdomen. You need to know where. Because if you give that injection, you don't pay attention, you're going to fail the question. Dr. Louis, how do I answer this question then? Listen to me. Once you're going to administer an airplane or any subcutaneous injection, you need to pay attention with the umbilical area, because you cannot be close to the umbilical area. Oh, that's very key. That's a very key Nclex question. Now, 2 inches away from the umbilical area. Now, you cannot be close, you cannot be too far. Now, you need to make sure from your abdomen, from the umbilical, the belly button, 2 inches away from right and 2 inches away from the left side. Remember this one. Now, how do you place, what is the location beside of the abdomen? The other location is going to be upper, right there, upper outer arm. Your upper outer arm, that's another one. The other location, the third location gonna be the anterior aspect of the thigh, of your thigh, the thigh of the patient thigh. Now, the next location, the next side is upper back. Upper back. If your upper back here, you have fat. You're looking for fat. So that's upper back, like you saw in the picture at the beginning. Now, the next location is going to be upper ventral or dorsal gluteal area. Gluteal area. Those are the locations you should administer subcutaneous medication in Nclex. Now, let's go back. Let's go straight to the point. How do you put in order? That's the question. How do you place in order? How do you administer heparin, for example, in order? If you're gonna give it into the abdomen, how do you do that? That's the key question. Let's talk about that. Everybody take note, pay attention. The very first thing you always do, like I said in the previous video, guys, you always review the more. You got your equipment. You knock, you present yourself, then you wash your hands and dry them. So, wow. Let's say once you are in the womb, the very first thing now from there, you're going to wash your hand and dry them. That's the point now. All right, Dr. Emily. Now, once I wash my hand and dry them, what I'm going to be doing now next? Now, I have my injection. Let's say that I have my injection now. That's my injection. So I'm going to inject that. Now, once you wash your hands and dry them, which is inside of the womb, which is the first now, from there, first thing to do, you wash it. Now, the next thing you're going to do to put in order, you're going to select the site. Now, you select the abdomen. Good job. Now, make sure once you select the abdomen, make sure you select the site where you're going to inject the heparin 2 inches away from the umbilical area. Let me say it again. You need to make sure you select the area 2 inches from the belly button. That's the key point. From the belly button, 2 inches away. Now, once you select, that's number 2. Wash your hand, number 1. Dry. And then number two, you select the site 2 inches away again. Now, number 3, you're going to have an alcohol swab to clean the site. You need to clean the injection site with alcohol swab and let it dry for seconds. Number 3. Number 4, you're going to pick up your syringe, your injection, your syringe. Once you pick up your syringe, what you're gonna do in number 4? You're gonna make sure you remove the needle cap by pulling it straight off the syringe, and you're gonna throw it away now in the sharp container. Oh, okay. Number 5. Once you do that, what is next? Hey, pay attention, listen to that. What you gonna do with your left hand? You have your injection ready. You have it ready. So what you gonna do with your left hand? What you gonna do with your left hand? Guess what? You need to grab something. You need to hold something. You need to make sure with your index, with your thumb, you're gonna hold something tight. So you're gonna hold the skin, the location side, the injection side. You're gonna make sure you hold it, you pinch it. So to make sure you got the mass you're looking for, you need to hold, to pinch it. Next, once you pinch it, you're gonna insert the needle straight down, all the way straight down. Once you insert the skin, you're gonna insert the needle next. You're gonna insert the needle, and the question is how many degree? What is the correct degree you insert the needle? And the answer is 90 degrees. 90 degrees is the answer. Now, once you insert it to this in the 90 degree, the other question you may have, 90 degree, if you are fat, you have what you're looking for. But, Nclex tip question, if the patient is skinny, that's another tip. If the patient is skinny, if the patient has malnutrition problem, number two, if the patient has AIDS, I know when the patient has AIDS, you know what's going on. If the patient is a patient, is disabled patient. The patient has no house to stay. The patient is sleeping under the bridge. The patient, so you know what it is. So therefore, those patients always are at risk of being of having malnutrition problem. So therefore, they don't have a lot of mass, fat. You pick up the answer that says 45 degrees, not 90 degrees. Remember this one. Now, let's continue. Once you plunge your syringe there all the way down, 90 degrees. Now, you deliver the medication. Now, once you deliver the medication, you need to release. Now, the next step, you release the skin. You release the skin and make sure there's nothing in there. Then you release the skin. Now, the next thing you're going to be doing, once you release the skin, the medication is delivered, you're going to make sure you put the needle not close to you. You make sure that down the needle and away from you. Then, once you cover it back, there's no needle, no risk. Now, the last thing you do, you get the needle, you put it on a container or sharp container, sharp collector. This is the step you do as a nurse when they give you subcutaneous injection. Remember it, the step, see it, watch it, share the videos. Guys, if you need a full review with tactics, strategy to teach you the contents, I'm doing facts, I'm doing some Nclex tip question with you. That's the purpose of this video, to show you how Dr. Lune can teach you pass your Nclex exam just like that. Like hundreds and hundreds of students have been helped by Dr. Lune, guys. If they pass Nclex with Dr. Lune, what about you? What about you guys? This is very exciting. So I have students every week, 2, 3, 5. Every week, students passing Nclex every single week. There's no game, there's no comparison. I don't have to jump like them. I don't have to lie about it. I don't have to say, okay, guys, I'm gonna have Black Fridays. I'm gonna have tutoring online. I don't have to. If you come to me in 12 weeks or 13 weeks, I'm gonna give you handout. I'm gonna make sure I explain every single page to you. This is what I do with my student, and that's why they pass Nclex every week, 75 questions, guys. Now, if you need a new video, if you need another video, encourage me, guys. Call me. If you want to review, guys, you speak Creole out there, call Dr. Lune. You speak English, you want a review, call Dr. Lune at 561-319-4660. I'm waiting for all of you guys if you need a full review. Now for the next video, I need more subscribers to have new videos for you guys. No more subscribers. I need my YouTube channel to move. I need to move on with my YouTube channels. Help me out there, guys. I'm trying to motivate some young guys out there. You take the exam 2, 3, 4 times and you get depressed, you get frustrated. You guys, I can definitely help you pass your Nclex exam. Thank you for watching this video. Continue, guys. I'll see you in the next video. And remember, my name is Dr. Luini, and the number to call is 561-319-4660. See you next time for a new video, guys. Thank you so much. Go ahead, guys. Go ahead and share the live, subscribe. Thank you, guys.